Well, measles has been in the headlines recently with outbreaks in Samoa and American Samoa. Joining me tonight is Dr. Ben Roney, a primary care physician at Adventist Health Castle, with what you need to know about this serious illness. Doc, we've heard about measles a lot, but give us a better understanding of what it exactly is.
So measles is a virus. It's commonly seen in children. It's a childhood illness that was really common in other places, but not very common in the United States anymore because of our vaccination rates.
Okay. Can you tell us more about the symptoms?
So it starts off, there's initially a period where there aren't really any symptoms. You then sort of begin to develop, fever, headache, general kind of cold and flu-like symptoms before you get a rash. Starts in the head, starts to spread out from there. And then usually the fever gets higher and higher. We're talking 103, 104, quite high fever eventually. And there's a lot of kind of secondary repercussions. You can have pneumonia, you have ear infections, a lot of complications with pregnancies, even encephalitis, so infections in the brain and stuff as well.
From the measles?
Yeah.
I'm kind of picturing the measles as something similar to chickenpox, at least what it looks like. Am I incorrect?
Not entirely. Chickenpox is more of a scabby rash, whereas the measles looks more almost kind of like a more allergic reaction almost. It's kind of red and lacy. And you also tend to get, again, it starts very much in one place and starts to kind of spread down.
May I ask, where do you get the measles? Where does the measles come from?
So, it grows within the nose, the mouth of an infected individual, and then if they cough, they sneeze, they get those virus particulates out into the world. You touch it, you breathe it, and you can get the measles.
So it's incredibly contagious.
Very much so,
You
yes.
can be in a giant room with somebody far away and they cough and that's airborne, you can catch it?
Correct. Movie theaters, airplanes, things like that.
Oh, wow. So we already talked about what's happening in Samoa, at least 72 deaths, most of them children, but how does what is happening in Samoa affect us here in Hawaii?
I think it's an issue of geographic proximity. I know we're a good ways apart, on a map, but as far as our neighbors in the Pacific, it's right there. I have family in Samoa. People go back and forth all the time, and it wouldn't be too difficult for someone who, doesn't have those symptoms yet to show up here, and the next thing you know, it can spread.
So I imagine to prevent measles, it's get vaccinated.
Correct. And that's one thing that the Lieutenant Governor went down there to do. They vaccinated, thousands of people, and the best way to prevent it is to make sure everyone's vaccinated.
Well, gotcha. And Doc, I got to ask you, there certainly is an anti-vax movement. What is your response to those who say that vaccines cause illnesses?
So if you look at this most recent measles outbreak, for example, a lot of the reluctance of people to get vaccines came from an incident that happened a year or so ago in Samoa where someone got the wrong vaccine. So it wasn't even the measles vaccine. Some kids had a reaction to it and they died. That caused a lot of fear in people. And when people are scared about things, if a little seed of doubt is really kind of all it takes, and they will start to back off. You see the vaccine rates fall. But there's dozens of people have died in Samoa. Thousands of people die around the world from measles. You can't really say the same thing about vaccines. And even if a very small minority of people have adverse reaction to vaccines, those rates are much, much, much lower than the rates of the diseases they're trying to prevent.
Gotcha. Very emotional topic for sure when it comes to the vaccine movement. But Doctor, thank you so much for giving us your time.
Thank you for having me.
We'll send it over to Lauren.